Zero. Hello, everyone. Welcome to the Your Company Health podcast, the podcast where we highlight the success stories of business owners and professionals. I'm your host, Andre Wright, the owner of The Wright Consult. Today, we are excited about our guest, Mr. James Washington of US Health Advisors. James, my friend, how are you?
I am absolutely wonderful. Thank you so much for having me, Andre. It's always good to have a great conversation, especially if it's in regards to something that I know, which I can't claim that I know too much, but I do know about the health insurance industry. So I appreciate you having me, and I'm glad to be here.
It's a pleasure, my friend. But before we touch on your story, I want you to set the tone by telling us, what's happening with insurance and what are some of the important changes?
Well, COVID has changed a lot of things for a lot of people, right? With that being said, when it comes to health insurance, as of, I think it was March 11th, the new administration came out with the new American Rescue Plan Act, where that was, really instituted to try to help, able Americans in different areas. One in particular is with health insurance. In regards to that, the scope of things that's going on with health insurance right now is that, one, prior to the new Rescue Act plan, I think it was about 9.8% of your gross income if you went through the marketplace. They've changed that. It's now about 8.5% of your gross income. So they've given you a little more subsidy, and they have opened up or reopened up the marketplace so that you're able to enroll or revisit whatever plan option you have up until May 15th. That's helped a lot of able-bodied Americans, especially that have gone through transitions in terms of their job. Another thing that they have also done is if you are on Cobra or have an existing Cobra plan up until about mid September, they will also be creating a subsidy for that. So you may be able to forego your Cobra payment up until that point. Now, they're not extending it. If you have it, you're not going to have an extension for your plan option. But if you are on a Cobra plan, you may be, contingent upon your situation, able to receive that plan at no charge.
So James, obviously you touch on a lot, and we're going to try and dissect it and and dive a little bit deeper for our audience. But before we go a bit further, I want you to just tell our audience your story and how did you get into the insurance business?
Absolutely. Well, with me, I prior to being an insurance agent, I was in corporate America as well. So I was in operations management for a few different companies. And one thing that was a resonating theme was, usually when it came to health insurance, I was able to, because I had a little bit of business development and, I had experience with group insurance. I already kind of had a little idea of that marketplace. But with that being said, you know how it is. As your family grows, at times you look for better ways to, support your family. And at that time, there were vertical changes. I would say lateral movements that were in the cards for me. And I had a friend of mine who we worked together at one point, and he cycled off into health insurance himself and started his own brokerage. And he said, James, let me invite you down. He goes, because you're very personable. You believe, and you usually couple what you do with your faith in terms of being intentional with people that you communicate with. And he said, I think there's a great way that you can not only enjoy what you're doing, but help other people. And here goes health insurance, right? So it was a learning curve for me because one, with me being in management, usually there's a duties and expectations that you have for individuals, right? Where in this arena, now I am asking for your business, right? Asking if I can help you. So it was It was a major transition for me, but I'm so blessed and happy to have the opportunity to service and help as many people as I can. So, making that transition, I definitely had to learn some different, things when it came to individual insurance to round out my knowledge. But so far, it's been it's been a great journey.
I want to say, James, I mean, this has to be your calling, man. From my interaction with you, it seems like it's a perfect fit. This for you to be in this type of space, you're knowledgeable of what you're doing. You're so personable, and it's easy to talk to you. And that's why I wanted to bring you on the show today, because I know that our audience is going to learn a lot about what you do and what you have to offer. I know initially you touched on Cobra, but we want to dive more into, and I want you to tell our audience, what are the services that you offer?
So with US Health Advisors, that is more or less your private insurance arena, your private insurance spectrum. But as an insurance agent, my job is to best serve the consumer, right? And with that, there are really two ways that you can satisfy sourcing your health coverage. One is through your income, which would throw you primarily on the marketplace, contingent upon how much you may make, gross wise. You may receive a subsidy or you may not, right? Other is you also have your short term, your private plan options, which usually are contingent upon underwritten medical, questions or your health, right? So there's two ways that you can satisfy your coverage, through your income or through your health. I usually have resources where I am able to do both. I can look at every plan option that's either on the marketplace or that may be available through the private insurance market space. And what I do primarily is contingent upon, the needs of the client. We can make a determination of what may best suit you, right? There are a plethora of plan options that are available. But when you get down to, when you get into weeds, there's primarily two major, you can either go to an HMO plan or a PPO plan. They have EPO plans, but your most, I would say that your most popular networks are HMO and PPO, and that can span from private or marketplace plans. Did that kind of answer your question?
Yeah, no, I mean perfectly. I think you explain it well. But for our audience, you're talking about the HMO and the PPO. Could you define those, for us?
Absolutely. Well, when you contingent upon your insurance provider, there are networks that you can they usually utilize. And your major networks, which would be primarily through group insurance, things like that, is going to be a PPO, right? And with a PPO plan, it has a bigger network of doctors and hospitals that you're able to use your insurance, that you're able to go to. With an HMO plan, it's more of a condensed option. It's not as vast, not as large as your PPO plans. Generally, if you have a marketplace plan, they are mostly, because it all goes by your zip code and your age, but most ACA plan options are going to be HMO, right? What that kind of means and what that looks like for you is that, there's a, one, if you go outside of your state lines with an HMO plan, you're only covered for emergency services. So once you go out, it's pretty much inoperable. With a PPO, you can go anywhere in the country. You can utilize anywhere in the country. Also, you do not need a referral for a doctor. You can go in and out of network or for a specialist. So with an HMO, you kind of have what we like to say is a gatekeeper, right? So your primary care physician will make the determination if or make that referral for you. Okay, so the difference is with HMO, you have a smaller network, more condensed. You have a gatekeeper as a doctor, meaning that you need to have a referral to see a specialist. With a PPO, you can go outside of the country. It's a bigger network of doctors and hospitals. And then also you can go in or out of network and still reap benefits from your plan. And you don't need a referral for a specialist.
So
Does that kind of make sense?
No, perfect. And so that makes PPO more expensive then, since it's so open.
And a lot of times it may, right? Contingent upon the area, the doctors, things like that. Yes, but a lot of times PPOs are a little bit more expensive than your HMO plans.
Okay, fantastic. And James, for our listeners and our viewers, they're maybe saying, watching this and saying, well, there are a lot of insurance agents and out there, trying to help me with programs. So what can you tell our audience? What differentiates you from another representative?
Well, first and foremost, I certainly agree. There are a plethora of agents and brokers that you have access to. The key is finding one that is licensed and a trusted, one that that is working in your best benefit. And so, a lot of times, depending if what companies they may work for, most interaction with your licensed agents it's a transactional it's a transactional relationship. And the reason why I say that is because you may pick up the phone, they may call you because you put your information in online, and they get your plan options, they explain your plan options, you pick this plan option, and they enroll you in that plan. Well, for me, I usually, with me, like I said, I kind of couple with my faith. So I believe in being intentional, right? We're all here to service and to serve in some capacity or other. And so for me, it is imperative that I do my due diligence by making sure that I take care of the consumer. So my interaction is a little deeper than that. One, when we first do a discovery call, I like to make sure, that I understand what the needs are of, the individual that I'm working with, whether it's a company, whether it's, a family, or maybe it's a single person. From there, once I get that information, I gather that information, what I will do is look at some of the plan options and let them know what their plan options that are available to them. From there, I like to go a step further. I like to do what's called is either a screen share, or we can jump on Zoom. And then together, we can look at those plan options. It takes 15, 20 minutes, but we can go over those plan options. That way, if they have any immediate questions or concerns, we can do that. So my position first comes from an educational perspective, right? So we want to make sure that we educate the clients. So once we do that, then they can make an educated decision on what plan options are best for them or their family. And you have a visual too, right? So as we're on Zoom right now, I can pull up your plan options and I'll go through them with you. And most people are visual learners, right? So it helps them out tremendously when they're able to, see their deductibles, max out of pocket, and understand all the little nuances of health insurance that sometimes when you just have a phone conversation, you don't retain everything, right? So I think the visual adds a different component to that. And from there, I am usually tethered to my clients. So out of the 1,100 or so clients that I have them all in my phone. They all can call me whenever they, except for Sundays, from 11 to 1. But they all have my number and I have them programmed in my phone. So that way, if they have any questions, if they need help with billing or claims or anything like that, they can come directly to me instead of talking to a 1-800 number if they don't want to. And then, I can help them navigate all those types of things like that.
And James, that's great. That's great because we all long for that personal attention in terms of a representative. By hearing you saying that, I know the importance of that personal touch. Be able to call my agent at any time and they pick up the phone. So that's a great attribute. So I know on the outset when we started, you touched a little bit about the pandemic. The situation that we're in now. I want us to dive in a little bit more. How has this impacted your client base and your business? Let's talk to us a little bit more about that.
Well, to be honest, for me, I've come across I love educated consumers, right? And so many times, with people the pandemic has really put people in peculiar situations because, maybe they were thinking about retiring, right? And they had it, pushed out maybe 6 or 7 months down the line or another year from now. Well, now some of them are taking it early. Some are forced to go into different positions. And so that would put them either where they lose their coverage altogether or they have a Cobra option that is made available to them. Well, unfortunately, when you may lose your job or you have to transition from your job, the Cobra option is a little bit more expensive. It can be because now what that does is that puts that on an individual status as opposed to the company paying in 50% for your health plan, right? So a lot of times it can get a lot more expensive. So with COVID, it's really it's made people really do a deep dive into understanding their health coverage and what's available to them, understanding their deductibles, understanding their max out of pocket, understanding their waiting periods. Because generally people that are have group insurance or work for major companies, that's a couple clicks. Well, let's just take this plan, and they don't really get in the nooks and cranny of their insurance. Well, now when you have to source possibly your own, or it puts you on the marketplace, you may not know what you're looking for, right? A lot of times people don't, they don't understand that. So now I think it's making a lot of individuals take a harder and deeper look and really put things in perspective with their finances when it comes to that arena. Is there an uptick? Well, absolutely. I'll give you an example with telemedicine, which has normally been extra fee or attached to whatever plan option you may have, or sometimes they don't offer telemedicine, meaning that you can call in your doctor and have a conversation just like this, right? Without going down to physically see them. Well, during the pandemic, a lot of doctors' offices have said, hey, we're not taking any new clients. We're not taking any new patients. And if you are an existing patient, then let's do a telemedicine. Well, if you don't have it on your insurance, it can get pretty expensive, right? There has been a 68% uptick since COVID in telemedicine health, right? But people are starting to see, just as you're working from home now, that some people are a lot more productive at home, right? So some doctors are enjoying it because if you have, say you have a sore throat or you have a cough or you have something just pretty trivial, you can do a telemedicine call. They can prescribe your medication, as long as it's not a narcotic or an emergency, to your nearest pharmacy. And people are seeing the convenience of that, right? So that's been one thing that's been huge. And now a lot of insurance companies are adding telemedicine. If it's not for a small fee, maybe it may be attached, and it is for free, as long as it's not, say, dermatology or a mental health type of thing, right? So that's one thing in particular, but there has been a lot of changes, similar to that.
Of course, and it's funny that you touch on telemedicine because I've spoken to a bunch of doctors and they mentioned the same thing to me. Utilizing telemedicine has been a huge thing for them now. It definitely increased their patient base in terms of the people that they see, because it's so convenient now. People can just get up and jump on their computer and speak with their doctor. It just adding to what you mentioned about the statistics, and it's definitely good for the healthcare industry.
Yeah, you have to think too, and as I have tried, now it's not a hard sell, when you come to your clients, because they understand, especially if they've had experience using telemedicine. Wow, I'm not traveling to go see the doctor. I'm not waiting to see the doctor. I'm not sitting next to individuals where you don't know what ailments or sicknesses they may have, right? So it has been a win-win thus far. And I think moving forward, that may be something that you may see more often utilized, going forward.
No, it is a big thing. And as you know, I with my field, digital marketing, I work with a bunch of healthcare practitioners, and telemedicine is something that we're doing a bunch of campaigns for, because we know that doctors, they are seeing the positive impacts of that on their business, so they want to even do more on that. So great point there. What is the impact on claims?
You have
Exactly.
so many, you see so many things that are attributed and due to coronavirus, but they may have had underlying issues and things of that nature, right? But they're all, they're all claiming that, at the end of the day, that if corona had anything to do with it, a lot of times they'll attach the corona virus to it, as opposed to, a heart attack or something like that, or if you have um, sarcoidosis or the flu or something like that. But with that being said, I think that one, I know, say with private insurance, for you to source private insurance, you have to be medically underwritten. So there are a series of medically underwritten questions. You go through underwriting, things of that nature. If you are in that, if you've had coronavirus, or if you are um, in a window where you may have had it or you don't have it, that might be a denial for you, right? They may deny you for coverage.
Right.
Now on the ACA, it doesn't matter what you have. They're taking in all pre-existing conditions and things of that nature. So, have you seen an uptick in claims? Yes, obviously, but a lot of them are, attributed to something else, right? But they're impacted by COVID. So, uh, I'm just looking for us to turn the corner. And I think it's very imperative and important for individuals, no matter where you're at, to do your due diligence to stay safe. So if that means, wearing your mask, if that means social distancing, or even getting getting inoculated and getting a shot, then, I strongly encourage folks to do that, because that's only going to help the situation and make it a little bit better, right?
Of course, and I agree with you on that. And James, I know you're a man of your stats, and I want you to tell us what are the leading claims you're seeing. What, if you could pinpoint in a couple of things, what are you seeing out there? Right.
With the numbers that I do see, generally in any environment, whether it's a work or usually they're struck by. And what I mean by that are contusions, back injuries, things like that, right? Now, has that changed over a little bit, since COVID? Yeah, I usually your minor stuff you're not worried about, but usually it's your accidents, right? You're struck by injuries, things of that nature, as a major uptick. Of course, you have your heart conditions, but that's always been pretty steady, right? That's always been pretty steady in its bucket. But I think, with people being at home, they're doing more stuff at home. They're, being more active, in their neighborhoods and things like that. With sports starting back up for kids and children and the school environment, what I'm seeing, on my side is more struck by type injuries.
So I wanted to tell us some of the best practices.
Well, for one, it's always best to acquire insurance when you're young. The older you get, the more ailments that you kind of pick up and you develop. Mm-hmm. My best advice is to be proactive and to make sure that you take your preventative care very seriously. I'll give you an example. So from 18 to 35, usually health insurance is lower for men, right? Women go through the child rearing ages, but after you get to 40, around 45, you see a switch. Women's, insurance for women starts to decline, and that, and for men, it gets a little bit more. And so the tables switch. And the sole reason for that is because men are just not that good at preventative care. Women are usually, they have their OBGYNs, they get the physicals. With us, I think, men try to take that stoic, attitude and they wait to the very last minute. Well, a lot of times, now you develop these pre-existing conditions. You develop little ailments that would drive the cost of your insurance up a little bit if you were to source your insurance other than the marketplace. But that's why it switches, because generally that's what happens. Preventative care for men goes down, preventative care stays consistent for women, and that's a disparaging thing. So I would, I'm a strong advocate of doing your due diligence when it comes to your preventative care, seeing your doctor, getting your daily checkups or your yearly checkups, and if you're feeling a certain way, go get it checked out. You know, the age of home remedies, sometimes if you are not if you are not a professional, really doesn't apply. So I always encourage people to make sure that they do their due diligence when it comes to preventative care.
No, of course, and you're so right. I mean, we as men, we tend to be so macho and we don't need to do this, and
I'm okay, right?
our wives always, they're at the doctor like every week,
Yeah, exactly. I'll give you another quick reference. So even with your dental care, something can start out as simple as filling a cavity, right? However, usually if it doesn't bother you, you don't think about it. Well, you can have 90% of your tooth rot out before you feel something, right? Now that turns into a root canal. You might need an implant, and that little filling that you could have attained or could have gotten early on now becomes $3,000 or $4,000 later with an implant and root canals and everything else. So do your due diligence and be proactive, right?
Of course. And, and you're so right. And James, someone is listening out there. What advice could you give us in terms of when there's an ailment, what are the first set of things that you should do? If there's an ailment and you want to you just want to reach out to your insurance, what are the steps? What are the important steps?
Now, and when you say that, let's put it this way. I always have a check down. First, to realize you get the best out of your insurance. Like I said, there's a 68% uptick with telemedicine.
Mm-hmm.
I would first go, if it's not an emergency service, if you do not need a narcotic medication, I would do a telemedicine call first, right? You're going to get, unless you're going to get more out of that call where they can tell you, okay, I think you should come in to see me. I think it should be the telemedicine call. Then you go in to see your doctor, and then your doctor takes the necessary steps from there. If you need to see a specialist, you can go to a specialist. If it needs to be hospitalization, you go to a hospitalization. But a lot of times people will go for the most simple things like a cold or a flu to urgent care. Mm-hmm. Urgent care facility is set up just for that nature, urgent care. That's not urgent care. You're going to pay more out of money. Sometimes your insurance may not cover that urgent care, cost. So always do your check down first and utilize the services for what they actually are, right? So if it is borderline, if it is severe, then you can go to emergency care and then go to the hospital from there or do that. But I always encourage my clients to do the check down. And worst case scenario, you can always call them.
James, fantastic advice. I want you to paint a picture of your ideal client for our audience.
Ideal client for me is really anyone who is self-paying, whether that be an independent contractor, 1099, small business owner. If you're going into business for yourself and you're just not sure, if you're coming off a Cobra, you may be going through a divorce and now you have to source your own health coverage. Those are ideal clients for me. And when I say self-paying, the reason why I say that is because that gives me an opportunity to see what plan options you have more. You have more opportunities when you are in that position, because sometimes people think they're only pigeonholed to the ACA. Well, guess what? If you're self-paying, you may not want an HMO plan, right? You may have a house in Florida and you want to make sure that you're covered in Florida, or you might have children or kids that are in college that go to those that are out of state. So I always say that I will work with anyone. My job is to best serve, the consumers who need health coverage. But more importantly, just knowing what's available for you, that's where you come to me, right? So anyone who is actually searching for health coverage that has lost coverage, looking to see if they can have more comprehensive benefits for their health coverage. Anyone, like I said, who is in that bucket where they're self-paying or going through Cobra and things like that. So,
yeah, and fantastic, James, and you brought a lot of value to the program today. And again, it has been a pleasure. Before we go, I want you to tell our audience how people are listening and they're watching it. How can they reach you?
Well, I would say the most you can always, for me, you can just pick up the phone and give me a call. My number is 404-819-2706 or at james.washington at ushadvisors.com. That is also my email. From there, we can definitely connect that way. I also have a company website that is www.usagent.com/James Washington.
Awesome. And James, we will definitely put that up for viewers and so they can actually see. But again, sir, thank you so much for your time today. I learned a lot. You provide a lot of value, and as always, it's always a good thing to speak with you about insurance because you're the man.
I really appreciate that, Andre, and thank you so much for having me. Would love to do it again sometime, but hopefully I was able to provide a little bit of insight, into the health insurance world. But as always, if you want to know more, like I said, please you can just simply get in touch with me.
Of course, my friend. Thanks so much, and we'll talk soon.